All right, everybody, it's the last presentation of the new year. We have just Jesse on for today because technically Boulder County is off today. Technically the chamber's off today. Technically most of the cities are off today. But we are going to run today's presentation because, as you know, last night we made the announcement that the governor is moving all red counties to orange as of Monday. Which is good news. It's good news for our businesses in town. It's good news for a lot of us. It was a surprise news. It's a surprise news for a lot of us because there was a process, and we're really excited to be able to send out that. I was actually really glad to be able to send out good news for a change. So that's why I did send it out late last night at 9 something, that as of January 4th, we will be moving to orange in Boulder County. Now, we've been in red for a while, so Jesse's going to try to run through some reminders of what orange means. And because I've already gotten a lot of emails like, what does that mean for last call? And what does this really mean for my capacity? And I don't remember what that is because we've been in for quite a while. So we're going to talk about that. I know there's a lot of questions about the immunizations. The announcement the governor made about the immunizations, I will say that was kind of a surprise. You just heard that as well. That was kind of a surprise. There is not an exact plan in place quite yet. They're working on that. Jesse may not be able to answer all the questions that I've gotten and that they've gotten about when you're going to get your immunization. What does essential mean? When is your place in line for the immunization? So he'll do his best today as to what the public health is planning on doing as far as that announcement. And then I'm going to answer questions today about 5-star because I know there's a lot of questions about that. So I will walk through the 5-star part of the presentation. So we'll answer those questions as well. So there's a lot going on right now. We're going to end 2020 with a bang, and then we'll start 2021. And I'm sure we're going to continue these as long as we need them to help businesses. So Jesse, go ahead and take it away. And then you and I will just play tag team today because we're getting a lot of questions via email, phone, text. It's just all coming in because there's just a lot of confusion and a lot of places are closed today.
Yep. Okay. So I will try to run through this so we can get to questions. I think I'm going to cover everything that Corinne mentioned, and then, as she said, we can tag team it. So some of these metrics may not seem as important now because we know our fate over the next couple of days, but as of earlier this week, we were way down from our peak. That's great news. That's really why the governor made the announcement he did. We're seeing some moderating in that decline, but it's more like we're reaching a plateau of cases, which is fine. We'd like to see it much lower, but in these times, this is what we've got. Again, just another way of looking at this, you can see the summer spike. You can see the, sorry, I didn't mean to go forward there. Just to be clear here, this is all of the metro counties. So you can see we are at the bottom of that trend, which is great. There are a lot of counties that are doing, that are moving to orange that aren't as as good a situation as we are. So we hope that trend continues, and we really want the community to continue pushing for that as we move along. So key takeaways from the epidemiological reports: our case numbers are declining. As I said, our long-term care facilities, however, cases remain high, which is a lot of where the governor's push on vaccinations came from. Our case rates are decreasing for all age groups, which is great, and our hospitalizations are decreasing. Again, that's going to look a little different from where we are on the dial. So I just want to put that out there that our hospitalization numbers are talking to the hospitals, getting numbers directly from them. The state is parsing it by county of residency. So there's a bit of a difference there. So where are we right now? I am still showing right now we are at red, and that's what I'm going to talk about, but we will get into orange, and I'll talk a little bit more about that in a little bit. So this is today's numbers. We're just below 350 cases per 100,000. That's why we're showing in orange for 2-week cumulative incidence rate. That's great, and it's actually been, I think it was Monday, it might have been Tuesday when we actually dipped below 350 cases per 100,000. So that's great. Shows a good positive trend. Our positivity rate is also in a good place. You can see in the metro area, we are the only county with a green positivity rate, less than 5%. So that's good news. Unfortunately, we're at 7 days or decreasing for 7 days of decreasing or stable admissions. So we had a spike of admissions and we're coming off of that. Again, that's not going to affect our dial status as the governor announced. However, it is a really good metric to understand how the community is responding to COVID-19. Our hospital metrics are all good. We are not headed into level purple, even if the governor puts us into orange. If we were going the wrong way, we could fall back into purple, but we are not headed that way. All of our numbers are good in terms of hospital surge metrics. Now, the news everyone found out about yesterday before I did this morning when I saw the email from Corinne. I should listen to the news more is basically what this means. On January 4th, which is Monday, the county will move to level orange along with almost all of the rest of the metro area. And the changes are going to occur in the morning on Monday. So, you know, I don't think it's midnight, but consider as you're opening your stores on Monday that your capacities are increasing at that point. And now our reminders, and I'm just going to go through this. We can come back to these slides at the end when you have questions. So overall, orange means capacity changes. It does not mean practice changes. All of your practices should remain the same, but your capacities are going to increase. Most sectors increase to 25%. Retail remains at 50% and will remain at 50% up until I think level blue. But you are at 25% in most other sectors. The details are where it gets a little confusing. For manufacturing, this is non-critical manufacturing. You may operate at 25% or 50 people, whichever is less, per room. So if you have a large factory with lots of rooms and a room is 4 walls and a door, then you can have 50 people possibly in each of those rooms. So that's an important change. Personal services, again, this is where it gets confusing. 25% or 25 people, whichever is less, again, per room. Now, for most personal services and limited healthcare, we're talking about small practices, massage or acupuncture or physical therapy. And so these 25 people per room numbers don't really matter, but in your shared spaces, you can feel a little bit more comfortable having more people in those spaces. For gyms, excuse me, I'm gonna clear my throat. For gyms, 25% or 25 people, this is a big change. And again, this is per room. Up until, like right now, it's 10 people. On Monday morning, it will be 25 people per room or 25% of the capacity, whichever is less, again. For restaurants, another huge change. 25% or 50 people per room, whichever is less. 10 people per group outdoors, and on-premises alcohol sales until 10 p.m. So you can now have indoor dining at restaurants. That is the biggest change maybe that we're going to see. You can have indoor dining. And just so you are aware, we as Boulder County are going to continue to limit the capacity inside at a table to 10 people per party. So right now the order is written such that it's unclear whether the 10-person limit is for just outdoors, but we are parsing that as 10 people per party, both indoors and outdoors, just to make that clear. And then on-premises alcohol sales, again, until 10 p.m. They've been till 8 p.m. Under red. Indoor events, and this affects real estate as well. So important here. Indoor events, 25% or 50 people, whichever is less. Occupancy defined by your social distancing calculator, which is available on the state website. Seated events may have a higher capacity, and the way that works is if if the entire event is seated, as long as parties are 6 feet apart, you can have more than 25%. Open houses must follow indoor events guidance. That's that field services real estate thing. So you can have open houses now. You could have them before, but they had to be one person at a time, very limited. Now you can have open houses up to 25% capacity in those spaces. Outdoor events, all the same rules as indoor events, except that that maximum is 75 people for those larger outdoor spaces. Sports. Indoor organized sports are still not permitted, except, and the asterisk there, because at the end of January, some school sports are going to be able to operate indoors. And we can get into more detail towards the end of the month, but just be aware that towards the end of the month, practices for some indoor, I believe it's season B sports, may commence. So indoor sports, again, not permitted for rec, for organized in any way, adult or youth. Outdoor sports, 10 or fewer on a field, social distancing and masking must be maintained. And then that's it. So reminders, everyone must wear a mask indoors. Face shields are not adequate. And remember, as a business owner or manager, you have the right to bar entrance or remove people who will not or cannot comply with the mask order. Do you want to jump into the 5-star program?
Sure.
Great. Okay.
So up until this announcement, there was a lot more urgency around this, and I know there's still urgency around this. So what is a 5-star certification program? So in the middle of December, the governor announced that this was now available to counties, and it was a county by county opportunity to institute a 5-star certification program. This was something that the county level would have to be stood up to allow businesses to certify that they're going above and beyond public health orders and have both an application and live inspection process to be certified and be able to operate one level above what the county is currently at. So if we were at red, that business would be able to operate at orange. The county has to opt into the program. Now, the big thing is that public health cannot lead this program. So I know a lot of calls are going into public health saying, where can I apply? Can I do this? Larimer was the first in the state to apply for this. And so there is a process that has to happen. And first, a county has to qualify to be able to apply for the variance for this. And my email yesterday did indicate that Boulder County does not qualify. And there's a lot of confusion around that. So let's go back a step and say, prior to when we moved to orange, we are working together as a community. The Boulder Chamber and Longmont Economic Development Partnership are co-chairing a group of most of the municipalities, all the chambers, economic development and public health, and the county coming together, figuring out how we can make this work, how we can take the applications, how we can do the live inspections to certify businesses, and putting together the application for when Boulder County is eligible to apply. Now, that was prior to moving to orange. So this was all prior to last night. So we are working through the authorization process of getting our county commissioners, the hospitals, the sheriff, all of them to sign off on an application process and creating the administrative, basically, capacity to be able to do this as a community, because we have thousands of businesses interested in such a program. To be able to send out live inspectors, how can we do that? Be able to accept the applications, to do the weekly reporting to CDPHE. The question I got a lot yesterday was, how do all these other counties like Larimer and Douglas and all of these that are in red, how can they qualify and Boulder County not? They're in red. They have higher numbers here. The numbers that are used when we were in red the numbers that were used to track eligibility for 5-star are different than the dial metrics. I need to indicate that because when you look at the dial metrics on the website, that's a one point in time dial metric. What they use to track for the 5-star program is a 2-week, 3-day rolling average over 2 weeks of 3 metrics. And the one that we have had an increase in is actually hospitalizations. And because we don't have a 2-week downward trend of hospitalizations, Boulder County was not eligible to apply for this variance. So that is the one where we were tracking when we were in red and we're not able to apply for the variance. That does not mean as a community that we're not working on the application and the process, and there's not all of us working together to try to create the infrastructure and the application as soon as next week to try to apply for us to be able to put this program together and get it in place. I just want to put that out there. We're working together to try to create this. I know that you've gotten emails from other associations saying these are the counties that are applying. We're working on it. We really are. The caveat is now we've moved to orange. This changes things. If we were to apply right now, it doesn't automatically mean that if we get the 5-star program, businesses that get certified automatically get to operate at yellow. What it now means is we actually have to qualify and be in orange metrics for 2 weeks in order for businesses to operate at yellow. Even those counties that have 5-star programs cannot allow their businesses that are certified to operate at yellow until they hit the metrics of orange. So those businesses that are certified will have to operate at orange until they hit the orange metrics. So even though they're certified, they're not going to automatically be allowed to operate at yellow, even though they're moving to orange. So there's going to be a lot of metrics tracking. There's going to be a lot of things. In the meantime, we are still working together as a community. The municipalities have been working very hard on how do they get support for this? How do they help with this? The chambers have been very involved in this. The economic development partners, public health. We've all been working to try to figure out how can we stand up this program with no resources to be able to do this as best as we can, and we're working on preparing that application. So I want to put that out there. But the metrics, I know that was the biggest confusing. When I sent out that email yesterday, I probably got 50 questions. How is that possible? And it's that one metric. It's that hospitalizations. Remember, we have 5 hospitals in Boulder County. And it's not the number of hospitalizations of residents, it's hospitalizations, and it's a 2-week average. So that, I just wanted to put that out there. The move to orange means that we now can operate at what we would be at if we were at red and we got 5-star. And so let's concentrate on trying to maintain and acquire our orange numbers so that we can stay for 2 weeks at orange or lower numbers, so that when we do get 5-star, you can operate at yellow. That is our goal at this point. Let's work together to get an application into CDPHE, get our numbers below that 350, which they are right now, maintain them below that, even lower. Let's get down to yellow so that when we do get 5-star authorization as a community, that you can legitimately operate at yellow or below. So that's what our goal is. So there's a little bit of technicality now under this 5-star now that we've moved to that orange. All right, so I have a lot of questions. I have a lot of questions that came in about that. We'll answer them, but that is the 5-star certification. But I just want you to know that we haven't put a press release out about it just because we're waiting for some final approvals from some locals before we officially put our application in. So
Thanks, Corinne. It's a lot of information.
Do you want to add anything on that? I try to clarify. Nope. The metrics are so confusing because it's not real visible.
Not the same. Yep, exactly. All right, I'll just continue on and then we can jump into questions. I think I've got some more information that might help answer some existing questions. Let's see here. So vaccination information. I don't have a ton of information about this, but I will give you what I can. So the county is still in phase 1A of the vaccination program. That means we're still vaccinating frontline workers in hospitals. So our healthcare workers who are frontline. The governor's announcement yesterday allowed residents over 70 into the 1B phase and clarified some of what the frontline worker group that they were planning for would be in 1B. And so that's expanded. I'm not going to go through a list of all those, but just to be clear, the planning for how that's going to work, since we're still in 1A, is ongoing. The way that, unfortunately, the way that planning for vaccine rollout has happened is the federal government is supplying the vaccine, but not really doing any planning. And the states are now having to do the planning, but each state is saying, look, this is too much for us to do. So asking each county to sort of take on the role of planning the details of who and when and how and where. Luckily, the why is answered. But we're going forward with that, and we're expecting phase 1A to be done mid to late January, and then phase 1B will kick in. We're going to try and start 1B as soon as possible, and we're going to be kicking information out to those people who would be eligible under 1B. One thing I do want to note, right now, we've been getting, now we're getting even more questions, but for a while we were getting a lot of questions from outpatient medical providers about how to get in line, where to get in line, and there wasn't a lot of information. Through a partnership with Boulder Medical Society, which I understand is a nonprofit, the Public Health and Boulder Medical Society are sort of creating that list of outpatient medical providers, staff at those facilities, all that sort of stuff, and creating the process for getting those folks immunized when their chances up, which I believe is under 1B. So,
and I sent out the outpatient medical provider form yesterday that you can fill out so you can be notified when it's your turn to be to find out when there's a clinic. The other question, so residents over 70, I'm getting a lot of questions because the governor added the term essential workers, and I think there's a designation of what essential workers are included in that phase 1B. And just like the outpatient medical providers, there will be a plan that Boulder County Public Health, probably similar forms, types of things that where teachers and grocery workers and those that were indicated in that 1B will be notified, and there will be some sort of plan that will be created in order for those populations to be notified. But it isn't, because it was announced yesterday, you don't have the plan today for today's call.
Right. Thank you. That's actually really helpful for clarification. Like, the plan is rolling out. It's not, we don't have a plan in place yet. We're getting there. And I do also want to sort of address, I know that at one point, the schedules that are out there right now have vaccinations going into the summer, and that's still our plan. But to be clear, across the country, the supply of vaccines is lagging behind what we understood the supply was going to be. So the federal government's goal was to have 20 million people vaccinated by today, and we're not anywhere near that. So, and 20 million people across the country. So we're not there, but the vaccines are still coming in as more are approved under emergency approvals. That means there's more supply, and so hopefully, this will ramp up as we go. But I guess I just want to assure everyone that there is planning going on, that this is not at the county level. We are not proposing a free-for-all situation, and we are trying to reach everyone as best we can. So that's what we know about vaccines. We can obviously answer any questions at the end. Moving on to another thing, small business grant program. This is a federal money that's been made available, passed to the state, and now the state is passing it on to counties and to our chamber partners and all that to try to administer this. Eligible businesses are restaurants, bars, caterers, movie theaters, and gyms. And there you have the annual receipts less than 2.5 million. And if you need to be able to demonstrate that you've seen a 20% or more reduction in revenue due to COVID. In terms of grant amounts, $3,500 to $7,500, and applications will be accepted for 21 days. And the reason that's just in there, we don't know the day that they're going to release this so that we can start accepting applications. There's some, it sort of depends, but it will be in the new year, obviously, because it's not today. So it'll be sometime next week. Hopefully that'll be open, and then it'll be a 21-day acceptance for the applications, and then the state will announce all of the eligible, all of the businesses that receive that. For more information, definitely visit this link. Corinne, you probably have a shorter link in your email. But
yeah, and I'll send it out to everybody. It's a county-run program. We're working on getting this released. We'll probably do a webinar announcing how to apply for these businesses. This is in state statute, and the money has to be dispersed by a certain date in February, thus the short time frame. The application is going to try to keep it as easy as possible. This was part of the emergency state legislative session. So, but it's the counties again that had to stand up the program and figure out how to make this happen. So the municipalities have been, and the partners have been working really hard to try to stand this up as quickly as possible in the new year, but it is in statute that this money has to be dispersed by a certain date. So we'll try to get a webinar and the information out as quickly as possible once it is all finalized. But I sent this out in yesterday's email as well.
Awesome. Thanks, Corinne. Okay, then just the same stuff I say every week. Exposure notification system, please sign up. The more people, the better. It is, we understand it to be very safe from a personal information perspective. And then finally, and this is an old slide, we're doing our Thursdays still. Next Friday is not Houses of Worship. I am hoping that I'm going to get some of my colleagues from from the education side to come and talk about K through 12 sports, as well as other sports as we move in, so that we can understand how under level orange, under possibly level yellow, when we get there, what that means. So hopefully sports, if you're interested, if you have children who are in school sports, this will be a good session for that. And then this week, I understand, and this is really my fault, there was no Spanish language session. There will be one next week, although I'm going to blame the governor for this one. He changed the information after I finished my slides. And so I wasn't able to get that translated in time. One of my colleagues does all the translations, and she needs time to do that. So we weren't able to get that out in a timely manner. So I apologize. But we will pick that up in the new year. And with that, our email, please email us questions outside of this. Corinne doesn't need to get all the emails, although I hear she loves getting emails. We want to support the business community as much as possible, so please send us emails with questions. We have a wide breadth of people that we can talk to try to get answers. And then if you have complaints or concerns, don't hesitate to call the call center, although it is closed today, tomorrow, and this weekend. So it'll open up next Monday. And with that, happy to answer questions.
All right, I'm going to start with this first question, which is, can we find out what's included in the 5-star so that we can start getting prepared? So I'm actually going to have you go back to the exposure notification system.
Yes.
Because I was going to give a hint. Oh. One of the things that's required under the 5-star system is that that you advertise and promote among your employees and all signing up for the exposure notification system. So I put in a link into the chat, the 5-star certification program, and the basic checklist that is required. Now, I will note that when we do develop the system, if we do decide to move forward, when we do develop the system, when a business applies, they will receive prior to inspection the list of probably up to 47 things that will be inspected upon. They shouldn't be a surprise. They're things that are in the orders. They're things that are in this checklist. They're things like, do you have a hand sanitizer? Do you have cleaning supplies? Have you, the things that are in the 5-star certification program talk about your HVAC system and your filters. Things like, do you have a tracing system internally? Do you do employee health checks? The things that you should have been doing all along, having to do with the orders and going above and beyond in those systems. So I put into the chat the link to the 5-star certification. There is a link to the checklist that are the basic checklists for the different industries. And just know that when you do apply, if and when we do move to the 5-star within Boulder County, you will receive the checklist to be prepared for your inspection at that prior to an inspector coming out. But it's your way to be part of the solution, to show that you're helping mitigate the spread of the disease. And as a reward, it is a way to, as you know, proving that you're, you know, we've always said all along, we have a lot of businesses going above and beyond. As proof of that, you know, this is one of those programs that rewards for that. So there we go. We answered one of the questions. So there's a question about would a facility rental be considered an indoor event or a personal gathering?
So it would be an indoor event. So you'd have to meet all of the indoor event guidance. A personal gathering is essentially anything that doesn't fit into another space. So if you're renting a facility for a wedding, for a party, whatever that is, that's a way to increase the capacities, because at personal gatherings, we're still quite low in terms of numbers of people that should be gathering. It's up to 10 people under Orange, but it is only 2 families, so or 2 households, I should say.
So there's a question. So when we were in Orange last time, Boulder County had Orange on Orange Plus. So there was the gathering, there were these additional orders that were added on by Boulder County that limited events to 25, that had additional limits to, you know, you can only be with your household, these tighter restrictions. Are those still in effect, or are we just going back to regular Orange?
So we are going back to regular Orange. You know, that may change as we get into this and we see our numbers compared to other counties. We may try to address that. So we may go to an Orange Plus situation. However, like you said before, our county trends are good generally. And so I think we will probably just go with Orange as it is, but I don't make that decision. And to be honest with you, our enforcement of any Orange Plus would be contingent upon conversations with businesses, with the chamber, with our epidemiologists. You know, this is not just an attempt to punish people. We're trying to base this in science as much as possible.
And we were in the Orange Plus. This was our way to mitigate some of the increase, and then the governor put us in red. So it was kind of, that was our mitigation strategy, and then we got put in red. So we didn't really get a chance to prove whether the Orange Plus was going to bring down our numbers at that time.
Mm-hmm.
I have a question here. I'm sorry, I'm late. Are we moving to Orange on Monday? Yes. Monday morning, we're moving to Orange. So the chart I sent out doesn't give full detail. I'm going to send out the order. There are some things that, you know, aren't covered by the just basic chart. For example, under gyms, it just says 25 or 25% or 25, but it doesn't say per room. So go to the order if you need more specifics, if you missed some of Jesse's presentation, and then again, we'll provide the recording. Once we reopen, it seems likely that our cases may go up. If we're in level orange for a few weeks and then we go back up, is there a chance we could go back to level red?
Absolutely. Yep, 100%. That's why the personal responsibility, wearing masks, limiting interactions are all still there. You know, it's a sort of weird thing to think about, but as you move up the chart, our personal actions make even more are even more important, because it's so much easier to interact with someone who may have the virus. So be careful and try to limit, again, continue to limit those interactions. unfortunately.
And one of the other things I sent on yesterday's email was we launched, again, at the end of the year, a Step Up Boulder County campaign. This was actually local business owners that we brought together, and there's actually a total of 17 videos. There's only 9. There's only 9 on the website, but we'll try to get access to all 17. But not only messaging, but business owners that are using the Step Up Colorado campaign that made it Step Up Boulder County, saying, don't gather, wear your mask, keep your distance, step up Boulder County so that we can stay in business tomorrow. And it would be good for businesses to also put that out there, to remind, their customers, their employees, others, to continue to step up, continue to do those good practices so that we can stay in business for tomorrow. So we tried to work with the county, the chamber, and all of our local. We've tried to work with the campaign to try to help you have some messaging that you could put out there as well that says, please step up today so we can stay in business tomorrow. And we thank the businesses that participated on such short notice to kind of create some of these powerful, impactful messages, because we want to keep these numbers down so that we don't go back to red, so that we don't lose some of these qualifications. All right, so we have some questions, some more technical questions for some of the industries. Do gyms still have to do reservations under this new level?
They do not. Nope, that's not part of the order.
It's not part of the order. Do pools still have one person per lane?
I don't have an answer on that. Our understanding is that we would go back to the way it was, which was you could have 2 people per lane if they were in the same household, and if they were cohorted. There was at one point some discussion of if you have people starting on opposite sides of the pool, you could have 2 people who were unrelated in the lane. My guess is that we would not go back to that, but I will look into that more and get an answer.
Okay. All right. So the question is about the sports webinar. It's not tomorrow. We're looking at the 8th.
8th, yes.
I actually want to take tomorrow off, just letting you know.
I would like that too, yes.
I don't want to work tomorrow. So we're going to take tomorrow off, but we're looking at the 8th for sports webinar. And then a follow-up question to that is, with CHASA starting some sports later in January, how does this impact a facility that's not a school that serves as the school's home gym, rink, or field?
So we've gotten a lot of questions about that. If you are the practice or game space for a CHASA sponsored sport or CHASA governed sport, you are allowed to have those practices, those games for those teams in whatever level we are in. So in other words, right now you can't have organized sports under Orange, you can't have organized sports. If we stayed in Orange to the end of January, and that's when CHASA Sports started up, and your facility was the home gym for the hockey team or the basketball team, then those sports could start, but just that team, not suddenly opened up to rec leagues or adult leagues.
Okay, and you'll have that'll probably be a good thing to join that webinar on the 8th about.
Okay. Yes.
All right. So a little bit about salons, personal services. So salons, personal services, a change from red to orange doesn't actually change much for salons. They stay at 25% capacity or 25. It doesn't change. It doesn't mean you get to increase capacity at all. You just,
nope.
It's just staying the same. Same with retail. Retail doesn't change at all as well.
Yep.
Okay. Now there is a question about hospitalizations. I did mention, the metric on the dial talks about resident hospitalizations, and there's that decrease, but the metric we talk about for the 5-star and the metric that sometimes you show is an increase in hospitalizations, and that it doesn't take into account residency. This question is about, are we saying that there are people from outside the county that come into our hospitals? And that's the case. Yes, but there's also the case that some Boulder County residents are going to outside hospitals as well.
Yes, absolutely true.
For essential frontline workers who live in one county but work in a different county, does that impact where and when they get vaccinated?
It's a good question. I don't know the answer to that. I would assume you get vaccinated where your business is located, so where your employment is located. But I will get an answer on that. I don't have it.
Okay. And then since teachers were included in 1B, do we know if that includes childcare providers or childcare workers? Or is that something we'll need to get more clarification on?
Absolutely, yes. I don't have an answer on
that. Okay. If we use the SurveyMonkey form for outpatient healthcare providers is there anything else we need to do to secure a spot in line, or is that for 1A?
I would check again the Boulder Medical Society website or the email that Corinne sent. I know that Indira at Public Health sent an email also to a lot of to Boulder Medical Society that was supposed to go out to their members. My understanding is that is all you need to do, but there may be some additional steps.
Okay, so check the Boulder Medical Society. Some of the people that are contacting me are limited healthcare providers, so they may not directly be a member of the Boulder Medical Society, yes, but have patient services.
Yes. So okay. I mean, to be clear about that, that is a call that Public Health and the Boulder Medical Society and the state are going to make in terms of what counts as outpatient medical services and what counts as limited health care that falls outside of that outpatient medical service. And again, it's that idea of how much exposure to COVID are you experiencing at any particular time if you follow the all of the requirements of your licensing agency, the state, and the county.
Okay. Okay. Great to know. So just curious about the looming variant strains. You know, there was a report this week that Colorado had the first case of the variant strain of COVID, or reported case, probably not the first case, the first reported case of the variant strain. Any updates on, this person said their friends, colleagues in Europe are dealing with increased shutdowns because of them. Are there any updates on how this might affect shutdowns, or heard that it's a little bit more contagious? Is there any updates on that?
So nothing beyond probably what you've all heard in the news, and that is that while it is more contagious, it does appear that it is, the vaccine is still effective against it. So it should not change any of our current behaviors and our practices in any way. As long as we're socially distancing and wearing masks, and you're not frequently coming into contact with aerosolized particles from someone who's sick, you should not be at any greater risk.
And then I got a question that came in via email that someone was surprised that they only got one round of the vaccine, but we're wondering if they can still be a carrier prior to getting the second round of the vaccine.
I do not know that. I know that there's ongoing research at this time related to how long the first dose is effective for. I know that Great Britain is considering possibly extending the time between first and second shots because they've seen some evidence that it can last up to 3 or 4 months before you need the second shot. But that's all through the news. That's not something that the United States is not changing their practice. Colorado is not changing their practice, and Boulder County certainly is not.
So, who should that person contact to get an answer on whether or not they still be a COVID carrier?
I don't. I mean,
because I'm not the best person to contact, so I just
you can email me, and I can ask around about that. But really, the other effective place is to go to covid19.colorado.gov/vaccine and see if they have any information about that. Yeah, that would be my recommendation.
Okay. Can you go back to the small business grant slide?
Yeah.
There you go. So someone missed the slide about the small business grant application. They will announce next week when applications will be accepted. They will probably be accepted in the next couple weeks, and we will send out. Can you go to the next slide?
Yep.
That's the website to start tracking. You'll apply on a. They haven't actually opened the application yet. They'll once they open the application, you'll apply through a link that will be available on this website, and I'm sure every chamber, municipality, and the county will send this out. I will send it out once the application does open, and you have 21 days to apply. There will be grant. There's a 3,500, a 5,000, and 7,500, and it's for specific yoga studios. I believe are considered gyms under this because under this the state statute. So you would be able to apply. All right, so I think there's 2 more questions. I would assume that orange and red data metrics will be updated around January 4th when they move the statuses from red to orange on the state website. As many metrics to currently show everybody in red, on the map. If they're, how do they decide when to return people to red? If our metrics are, a lot of counties are showing red metrics, but they're showing orange. What are they going to do?
The governor hasn't outlined that. I would expect we'll get more information about that next week. That has not been outlined at this time.
Okay. Can you go back to the epidemiological update slide?
Yeah. This one or the takeaways?
I don't know, Lisa, could you clarify which slides you'd like? And not takeaways.
So I'll go through them here. There's this one. That's all age groups. And then this is all counties in the metro area. And that's all of them. And then we've got our dial metrics. Yeah, don't know.
So, well, either hospitalization, we're not doing well.
Yeah, so hospitalizations, right. We were in a positive trend on hospitalizations, and then over the last couple of days, that's gone downhill.
Okay. And I have another question about the grant process. Is the grant first come, first serve? How many awards are available? It is a competitive review process. There's a certain pot of money that is being given to Boulder County. And they have to collect the grants, and then they review, and then they award them. You are eligible if you received money from other grant programs. I think I put in all of that into the email as far as your eligibility. If you have any further questions, just email me and I'll forward them on to the committee that's actually working on this within Boulder County. I'm not on that committee, but I can get your questions answered for the grants. Like I said, they'll be opening those up pretty quickly, and we'll try to do a webinar to try to answer a lot of questions before you go through the process of applying, especially if you're on the, on the cusp of whether or not you can or cannot apply. So it's a limited eligibility as far as the different industries. Also, don't forget, if you are in one of the industries that it's the sales tax, you get relief on your state sales tax. If you have any questions about that, there is a process to go through on that. And I have sent that information out, but if you need a refresher on what to do there, please email me and I'll resend that information out as well. There is a question, another question about the 5-star program. If it's going to take you a lot of time to get ready for the inspection, the way it will work is you'll apply. If your application meets the minimum qualifications to be able to assign inspector, Command Central, which will be a third-party vendor, will call you and will schedule an inspector to come out. We'll send you the materials and you'll be able to schedule an inspector to come out. So if it's going to take you 1 to 5 days to prepare, you can schedule an inspector to come out 5 days later. If you want the inspector to come out the next day, we can try to find an inspector to come out. Now, I will say, we are doing this on a shoestring budget. We don't have a budget to do this for. We will have probably an app, if we decide to move forward with this program, we will have a minimal application fee to help fund the administration of this. And we will be asking for donated and train the trainer inspectors from both the business and municipalities. They will, donated time to be able to do an inspector corps that can commit time to inspections. They will be trained, they will be monitored, and the data will be tracked. So that will be something that I will be going out to the business community about if we move forward with the application. But the inspector will come out. It'll be about 2 hours, and that will be something that if it's going to take you 5 days to prepare, you can plan the inspection 5 days later. So, any other questions out there? It's less than 12 hours till 2021, everybody. I don't know why, but I just thought about, saying it's 2021. And if you just joined this call, if you didn't hear the news, Monday morning we will be moving to Orange in Boulder County. If you need a refresher on what Orange is, we will send out the recording of this video, cutting out the chit chat at the beginning, and then we will we'll send out a recording of this video. And then what we will also do is send out a link to the order. The best place to get the information is the order. The chart is very minimal information. Oh, I have a couple more questions that came in. Are yoga teachers part of the teacher definition for vaccines? No.
They are not. Nope. That's K through 12 education.
Okay. So then there's 2 more questions about 5-star. I put the qualifier if on Boulder County moving forward with 5-star. We still need some approvals. There still needs to be approvals from a certain group of, we still need approvals from the county commissioners. We still need approvals from the 5 hospitals, and we still need approvals from the sheriff to move forward. It is on the docket to get this brought in front of them to get approvals. We have a program to present them. We have an administrative committee that we're forming. So I have to put a qualifier in there until I can officially get approvals. And I want to be frank, until I officially get approvals. But we've put committees together. We've had an exploration committee. We're presenting this information out there, and we're doing everything we can to push this forward and push an application forward and present a model that could work in Boulder County that meets public health standards, that we can resource out without putting too much strain on public health or any particular entity within the county. So the reason you hear me say if is because I don't have final approvals yet, and I don't have that letter that can go in with the applications. So just know that's I've been working on that this week. Longline Economic Development Partner has been working on it. Many hours of, we have a solution that we have to present, and we just need that opportunity to present it to the entities that need to sign off on it per the CDPHE application. Now there is a question about Mesa County, and we know what Mesa County did. And I know that some people here on the call also operate in Mesa County. Mesa County is actually not operating under the new 5-star model. So the new CDPHE 5-star, while it was based on the Mesa County model, it was actually elevated to a much stricter, more administratively heavy model. And Mesa County is actually opting out of operating under the new 5-star. So what they did in Mesa County is not what we can do and what we are going to be able to do in Boulder County. So we're having to basically create a new model here in Boulder County. So so just letting you know that it won't be exactly what they did in Mesa County, but that was the baseline of what they created to really look at the program. But even Mesa County is not operating under the new 5-star. All right. If all approvals come in, will the county definitely try to do it? If all approvals come in, just know that I have an application prepped in my Word document that I'm going to be offering up to the county to submit. We have a third-party vendor, the business application, the initial inspector core, the inspector model. We have all of that built out. So I just want you to know that a lot of time and energy has been going in to the meats and guts of a program for a 5-star type program. If we can get approvals and we can show, if we can show that this would be a great resourced out program for our community. All right, let's see, we have a couple more. How are yoga teachers defined?
Yoga teachers are defined as part of a limited healthcare or probably personal services business. Okay. In terms of vaccine, they would be considered part of the general public, the 18 to 64-year-old age group.
All right, so they'll probably be in with a lot of the later businesses.
Right.
Okay. Because even retail is not in some of the earlier rounds.
Right. Yeah, that should be. I guess I should say that retail businesses are also divided into critical and non-critical retail, and only critical retail would be considered in that frontline worker category.
All right. Any other questions? All right. Happy New Year, everybody.
Happy New Year, Corinne.
Happy New Year, Jesse.
Thank you. Thanks, everybody. Thanks for your time. Thank you, Corinne. And see you in the new year.
See you in the new year. We'll see you next Thursday and Friday.
Excellent. I'll be there. Bye, everybody.
And the person who just raised their hand, if you want to email me, I can have a separate phone conversation with you. We're gonna sign off, and then we'll see you in the new year. But if you wanna call my cell phone, we'll do that. Thank you. Have a wonderful day.
Thanks, everybody. Bye-bye.